Praise be to the God and Father of our Lord Jesus Christ, the Father of compassion and the God of all comfort, who comforts us in all our troubles, so that we can comfort those in any trouble with the comfort we ourselves receive from God. Thank you, HYGIENE youth group and the AV team for this opportunity and for all of your help. I'm not much of a public speaker, so I'm a little nervous, but given the opportunity to talk about mental health to our community is a big reason why I went into the field and why I'm so passionate about it. Mental health, there's a stigma about mental health in our society, but specifically in the South Asian community as well. The stigma is that mental health issues do not exist, or that people are shunned and isolated for them. God gave us this community, something that we are so fortunate to have and many may not have, to uplift and support one another. The same way that we support those that are going through physical conditions and physical illnesses, going through the loss of a loved one, is the same way that we should support not only those that are struggling with mental health problems, but supporting the families that may have to navigate these mental health issues as well. So before I get into any information, if there's one takeaway that I want from this talk, it's to talk about mental health more. Normalize the conversations about it. Support one another so that people know it's okay to feel the things that they're feeling. It's okay to struggle with the things that they may be struggling with and that they're not alone. Mental health is obviously a very broad topic. So specifically for today, I'm kind of covering depression and anxiety, which are two of the most common symptoms that people experience. So I'll cover some of the symptoms that people might experience, causes or risk factors that could increase the likelihood of someone experiencing these things, and then also tips and resources to help with mental wellness. So signs and symptoms of depression, we'll start with depression first. These are some of the most common symptoms that people might experience. So persistent feelings of sadness and hopelessness. The main word here is persistent. It's important to recognize that feeling sad, feeling these emotions is normal. It's a normal emotion for everyone to experience, and it helps us process a lot of things, right? It helps us process grief, the loss of a loved one, or whatever it might be. When it comes to depression, this is when we might notice like a more persistent or constant feeling of sadness and hopelessness as well. Another big one is the loss of interest or pleasure in like normal activities. So if you notice that you don't have as much enjoyment in certain hobbies or things that you typically would enjoy. If you notice that you don't find pleasure in social activities or social situations. Another big one is sleep disturbances, fatigue, and lack of energy. So if you notice you're constantly feeling tired, you don't have a lot of energy throughout the day, you're not getting as good quality sleep, or you notice that you're oversleeping more than you normally would, this can be a sign of or a symptom of depression as well. Anxiety and restlessness. So depression and anxiety actually a lot of times go hand in hand. So someone that's experiencing depression or depressive symptoms oftentimes experiences anxiety as well. So if you notice an increase in anxiety, that can be a depressive symptom too. Increased irritability. So if you notice you're easily agitated by things that you might not normally be agitated by, that can be a symptom as well. Difficulty concentrating and remembering things. So if you have difficulty focusing on day-to-day tasks, if you have difficulty kind of remembering things that you normally would, you kind of feel spacey, that can be a symptom as well. Reduced or increased appetite. So with these symptoms, everyone is different. So we experience our emotions differently, and so we also may experience different symptoms based on different people. So some people might notice a lack of appetite if they're feeling depressed. They don't have any desire to eat. They don't enjoy normal foods that they normally would. Other people might notice an increase in appetite. They're eating more than they normally would, and maybe they're not as conscious of or aware of their eating. Another one is recurrent or frequent thoughts of suicide or death. This is a really big one to try to be self-aware of, and also if we notice this in our loved ones. So frequent thoughts about death or suicide. Physical ailments such as back pain or headaches. So it's important to kind of recognize how what we're feeling mentally is correlated with what we feel physically. So a lot of times, if you're struggling mentally, you'll notice physical symptoms, and vice versa, right? If we notice that we're feeling physically sick or physically under the weather, a lot of times we might not feel mentally as aware as we normally would, right? So if you notice more physical symptoms, that can be a sign of depression as well. I have a quote here at the bottom: "There is hope even when your brain tells you there isn't," John Green. And a lot of times this is what people with depression experience. Our brains are very powerful, right? So they can kind of convince us of this hopelessness that we're feeling. So it's important to remind ourselves that there's hope even if our brain is convincing us sometimes that there isn't. Next slide. Thank you. So causes and risks of depression. These are potential causes or risks that could trigger depression or increase the likelihood that someone might experience depression. A big part of the stigma is that depression is just a thought process, right? It's just someone's way of thinking. But a lot of times it's actually biological differences and chemical imbalances in the brain that can cause someone to experience these symptoms. So there can be a lot of science that goes on behind it. Inherited traits, too, can be a potential cause. So if you have family members or that have experienced depression or mental health issues, you have an increased likelihood of experiencing those as well. Hormonal changes, such as pregnancy, thyroid issues, menopause, these hormonal changes can trigger depression as well. So it's important, if you're experiencing something that might cause hormonal changes, to kind of be aware of your mental health and any changes that you might notice. Serious or chronic physical illness can be a big one too. Like I said, our physical and our mental health are correlated. So if you're struggling with a physical illness that's chronic, that can also trigger depression. Certain medications can actually have side effects that might be depressive symptoms. So it's really important to kind of be aware of the medications that you're taking and the side effects that they potentially might have. Any substance use with alcohol or drugs can trigger depression as well. Alcohol is a depressant, but the more constant use of some of these things can trigger depressive symptoms and depression long term. Traumatic events or stressful situations can trigger depression as well. Examples: any form of abuse, physical, verbal, sexual abuse, difficult relationships, financial problems, a loss of a loved one can trigger these depressive symptoms as well. So unfortunately, sometimes we can't plan or prepare for a traumatic event, or we don't know that, a difficult situation might happen. But if we go through something like that, it's important to be extra self-aware of our mental health and recognize if we're noticing any of these symptoms. Signs and symptoms of anxiety. So we'll move on to anxiety next. These are some of the most common symptoms of anxiety that people might notice. So to preface this, some anxiety can be normal, right? It's normal to feel nervous. It's normal to feel nerves, like I did before this. But, we talk about a thing called good anxiety, quote unquote, which we might experience before something positive, right? Before you start a new job, when you're meeting new people, we might experience a little bit of anxiety. That can be normal. When it comes to anxiety that can maybe be problematic, it's when it's a feeling of impending danger or doom that might be out of proportion, maybe, of the situation that we're experiencing. Anxiety can come with a lot of strong physical symptoms. So sometimes people that experience anxiety notice more physical symptoms than they would of other things. For example, increased heart rate, rapid breathing. You might notice a change in temperature. When you're feeling anxious, you feel really hot, you start sweating. Some people might feel really cold. You notice you're restless, you're kind of shaking your leg, or you're trembling. So those can be some of the physical symptoms that you might notice with anxiety. I think it's important to kind of just be aware if this fear or panic is interfering with day-to-day activities. That's when it can become problematic. If the symptoms cause us to avoid certain situations or places because we don't want to feel those symptoms, that can be when the anxiety might be more severe. Another big symptom is difficulty sleeping. So any sleep disturbances, again, if you have trouble falling asleep, if you're waking up constantly, that can be a symptom of anxiety as well. Difficulty concentrating can be another symptom of anxiety too, but also if you notice that fear or anxiety, the present worry is the only thing that you can think about. So you're not able to focus on anything else, and that anxiety is kind of clouding your brain. That's when it can be more severe. And then I have a quote here at the bottom: "This feeling will pass, the fear is real, but the danger is not." So again, this is something to kind of remind ourselves. Like I said, our brain is powerful, right? So when we feel anxiety, it can make us feel like that danger is very real. So it's important to try to remind ourselves that what we're feeling is real, but sometimes that danger may not be. Next slide. So causes and triggers of anxiety, this is, again, like possible causes or increased risks for anxiety. It can be inherited traits as well. So again, it can be genetic if you have family members that experience anxiety or have an anxiety disorder, you're more likely to experience those symptoms as well. A traumatic event can trigger anxiety, not only in that specific situation, but long-term as well. If you have heard of the fight or flight response that people might experience when they're going through trauma or they're in actual danger, our brains can actually sometimes stay in that fight or flight response. So we feel more long-term anxiety after a traumatic event. It can also be a side effect of certain medications. So again, it's important to kind of consult with your doctor about any medications, even if they're for physical ailments. They might have certain side effects of symptoms of anxiety. Underlying medical conditions or illnesses, such as asthma, respiratory issues, withdrawal from drugs and alcohol, certain cancers, these can trigger those anxiety symptoms as well. It's important to note it can be from a traumatic event, but it can also be a buildup of stress that can cause anxiety. So it doesn't have to be from one specific traumatic event that someone might experience. It can also be from a buildup of stress that someone might be experiencing. Drug or alcohol use can also trigger symptoms of anxiety, especially those stimulants, and it can lead to more long-term symptoms of anxiety as well. Other mental health disorders, so again, like I said, people that are experiencing depression, for example, or have bipolar disorder are more likely or more at risk to experience anxiety as well. So disorders and diagnoses, so these are some of the most common disorders and diagnoses related to depression and anxiety. There's a lot more than these, but these are the most common ones that we see according to the Diagnostic Manual of Mental Health Disorders. So when it comes to depression, major depressive disorder is the most common one that we'll see. Persistent depressive disorder, which is similar, people are experiencing those similar symptoms that I talked about. It's just a difference in the length of time that someone is experiencing those symptoms. So persistent depressive disorder, someone might be experiencing those symptoms for sometimes 2 years or longer. Bipolar disorder, if anyone's familiar with that, there's a lot more symptoms than depression that go into bipolar, but bipolar is kind of experiencing the very high highs and the very low lows. So those low lows would be what's considered depression. Postpartum depression, so after pregnancy, women might experience depression. Seasonal affective disorder, this is when those depressive symptoms are correlated to the seasons. So you might notice a beginning and an ending of these symptoms based on the season. So a lot of times during winter, people might experience those depressive symptoms. Premenstrual dysphoric disorder, so this is when someone's depressive symptoms are correlated with their menstrual cycle. And then when it comes to anxiety disorders, generalized anxiety disorder is the most common one that we see. Obsessive compulsive disorder is another one, and this is when someone has excessive obsessive thoughts and repetitive behaviors. Panic disorder, this is, people are experiencing symptoms of anxiety, but they experience frequent panic attacks. So their anxiety is extremely severe in situations. Post-traumatic stress disorder, PTSD, so this is, again, if someone's experienced a traumatic event or traumatic situation, they might suffer from PTSD afterwards. So they have those symptoms of anxiety from that traumatic event. Social anxiety disorder, this is when someone experiences anxiety in social situations, and this can be, it's kind of broad, but it can be a variety of different social situations. And then various phobias, a common one people may have heard of is agoraphobia, so that's the fear of crowded spaces. Being in a place with a lot of people can cause someone to feel that anxiety. So next I'll get into some tips for mental wellness to kind of help with your mental health and your mental well-being. A big one that we talk about is practicing mindfulness, which is pretty much being able to ground yourself in the present moment. It's a way to kind of focus on the present. A lot of times our anxiety can come from being too in the past or being too in the future, right? We're focused too much on past situations, or we're constantly in worry or fear of the future. So mindfulness is a way to kind of practice grounding yourself in the present moment. It's really helpful with anxiety, with anger, with stress, with a lot of different things. So there's different kind of things to practice for mindfulness. A big one is meditation exercises, and meditation is broad. There's a lot of different types of meditations out there to try that can be helpful. And they're easily accessible. You can find them on YouTube, you can find them on Spotify, or whatever it might be. Some different examples of types of meditations. One is body scanning meditations, which is when the meditation focuses on kind of relaxing your physical body. Sometimes these meditations will focus on like one muscle at a time or one body part at a time and kind of relaxing your body that way. There's also sitting or walking meditations. So again, people have experienced their emotions differently, and also different things might help different people. So sometimes people find it therapeutic to be outdoors, to be walking. So you can find meditations where you're being mindful while you're walking. Or you can find ones where you're being mindful while you're sitting in a comfortable space. Guided imagery is another type of meditation where the meditation might focus on imagining yourself by a waterfall, for example, or somewhere that's soothing. So it helps kind of relieve some of that stress, and your mind is focused on that guided imagery. Deep breathing exercises is another really helpful mindful practice. Breathing can sound simple, but a lot of times when people are experiencing anxiety or some of these symptoms, it can be difficult to kind of focus on your breathing and regulate your breathing, right? Sometimes you'll notice you have a rapid heart rate if you're feeling anxious. So breathing is a helpful tool because your breathing is happening in the present moment, right? So if you focus on your breathing, it's a very helpful grounding tool. There are a ton of deep breathing exercises out there. You can find one that you kind of feel comfortable with. Simple ones that I can suggest are triangle and square breathing. It's kind of what it sounds like. So with triangle breathing, it's where you would breathe in for 3 seconds, you hold for 3 seconds, and then you breathe out for 3 seconds. And square breathing is similar. It's just for 4 seconds. So these are some helpful kind of deep breathing exercises to practice mindfulness. Yoga is another one, similar to meditation. It kind of incorporates relaxing your body a lot of times and also focuses on your breathing as well. 5 senses practices, so engaging your 5 senses to help ground you in the present moment can be really helpful too. So there's a 5 senses kind of tip that can be helpful, and it's nice because you can do it anywhere and you don't need anything with you. It's pretty much recognizing 5 things that you can see from where you are, 4 things that you can physically touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. So engaging your 5 senses to help ground you in the present moment. And then gratitude practices can be another helpful mindful practice. A lot of times, we're kind of on the go, or we're kind of taking things for granted. We don't really recognize things to be grateful for in the present moment. So kind of taking a moment to practice gratitude can be a helpful mindful tool as well. A lot of times we recommend to people to kind of practice this in the morning. Again, like I said, I think a lot of times we get up and we go, or we're on our phone. So taking a minute or 2 out of our day to start off and recognize 2 to 3 things that you can be grateful for can help you to start your day more intentionally and also practice that mindfulness that we talk about. And the next one I'm going to talk about is sleep hygiene. So this is a really big one for mental wellness that we might not recognize how much of an impact it has on us. Our sleep affects not only our physical health, but our mental health too. So practicing good sleep hygiene can be really helpful. Creating a healthy sleep environment, right? So low lighting, maybe a cool temperature, not a lot of sound, whatever it might be, something that provides a healthy environment for you to sleep in. Turning off electronics an hour before bed, this can be a hard one, but trying to stay away from those phone screens or those televisions can help you get to sleep quicker, but also help you get better quality rest as well. Avoiding large fatty meals prior to sleeping can be another helpful one. Reducing stress, so possibly trying practices to de-stress before you sleep. So maybe like a meditation practice, 5 to 10 minutes before you go to bed can be helpful too. Exercising, so sometimes it can help us to release some of that physical energy before we go to sleep as well. Limiting caffeine, especially maybe later on in the day, can help you to get to bed quicker and also help with that quality of sleep. And then establishing a nighttime routine. So having a routine in place can be helpful too. Brushing your teeth, praying, journaling before you go to bed, and kind of sticking to a consistent nighttime routine can be really helpful. Okay, so the next one is one that I think can be helpful for everyone to kind of practice. It's how to reframe our negative thoughts. So a lot of times we have what we call automatic negative thoughts, or ANTs for short. On this slide, it's called cognitive distortions, but it's kind of the same thing. So these are thoughts that we might automatically have in response to a trigger or a situation. What causes these is maybe past experiences, right? If we've experienced something difficult or traumatic in the past, that's going to influence how we might perceive similar situations in the future, right? And these are thoughts that we might not even recognize at first, but these automatic negative thoughts influence how we perceive situations, how we feel, and how we might behave in those types of situations or respond to them. So the first step in being able to reframe these thoughts is we have to identify them, right? So we have to be self-aware and kind of recognize when we're having these thoughts. So on this slide, it's kind of small, but these are some examples of common automatic negative thoughts, or ANTs, that people might have. I think these are things that we all tend to do from time to time, but you might notice that you struggle with one more than others. The first one is polarized thinking, so that's all or nothing thinking, where we focus on being perfect and we kind of don't allow ourselves to make mistakes. The next one is what we call mental filtering, which is pretty much a way of saying pessimistic thinking, where we're focusing only on the negatives and we don't recognize any of the positives in a situation. The next one is overgeneralization, so this is when we kind of clump all situations or similar situations as one. So we make an assumption that this situation is going to turn out the same as a previous situation, right? Jumping to conclusions. So this is different forms of assumptions that we might make, right? One is what we call mind reading. So that's when we make an assumption about what another person might be thinking. So maybe we assume what they might think about us, or we assume their intentions without having any evidence. And then another form of the assumption is what we call fortune telling. So this is when we might assume or predict the outcome of a situation, again, with maybe we don't have the evidence behind that. Catastrophizing, so this is when we over-exaggerate a situation or an outcome. Personalization, so this is when we tend to take a lot of things personal and we kind of internalize them, which causes us to have a direct response when sometimes it might not be necessary. And then the last one on here is blaming, so this is when we might blame other people or play the victim role, and which causes us to maybe not take responsibility of our own actions or our own part in certain situations. So this next slide is how to kind of reframe those unhelpful thoughts that we might have, right? So the first step is being able to maybe recognize that thought that we're having, and then the next step would be, how can I reframe these thoughts into a more positive thought so that it can change maybe my perspective on the situation, how I feel, and how I might behave. So on here, it's kind of a simple tool is recognizing the trigger. So what is the trigger that caused us to have that thought? What is the situation that's causing us to have that thought? Then recognizing the automatic thought that we're having. So on here, the example is the trigger is I made a mistake at work. And then the automatic thought is I'm going to get fired. I always mess up. This is it. I'm no good at this job. So again, you can kind of see how that might be an assumption, right? And it can cause us to feel anxiety. It can cause us to feel fearful. So then the next step would be, how can I reframe that thought into a more positive thought? The new thought might be, I messed up, but mistakes happen. I'm going to work through this like I always do. So you can see how that can influence how we might behave in that specific situation. So this is kind of a helpful tool. Again, it can be difficult if we don't recognize the thought first. We have to be able to recognize the thought and then be able to reframe it. The next slide is some other tips that can help with mental wellness. So practicing self-care is really important. I think a lot of times we tend to neglect ourselves. We're focused on taking care of the family, work, school, whatever it might be. But it's important to take care of ourselves as well, do things for our mental wellness. So practicing hobbies, doing things that you enjoy, having some time, whether it be in the day or the week, to set aside to do some of those things. Physical self-care can be important too, right? So taking care of your physical body, doing things for your physical self is important as well. Learning something new can be a helpful one. So if you've ever experienced where you're learning a new skill, when you notice that progress, we tend to feel more confident. It increases our self-esteem, and it also increases our motivation because we notice that progress, and it motivates us to make more progress, right? So learning a new skill can be something helpful to practice. Connecting with others, so socialization and connection can be really healthy for our mental wellness as well. Practicing a healthy lifestyle, so like I said, our mental and our physical health are strongly correlated. So, exercising, eating a balanced diet, practicing healthy daily hygiene, those are things that can help with our mental health too. The next slide is just some resources. So if you notice that you struggle with any of the symptoms that I may have talked about or anything that just feels off, it's important to kind of reach out and use those resources that we might have. So finding a healthcare provider for treatment, if you notice any of these symptoms, contacting psychiatrists, psychologists, a therapist. Also, there's mental health programs that focus on specific symptoms that you might be struggling with. So you can reach out to your primary care provider. They can give you different resources within your network, or you can, if you go through insurance, they can give you resources within your network as well. I think I spelled it wrong on the slide, but it's NIMH.gov, National Institute of Mental Health. That site provides basic information on mental health disorders that you can kind of look at and educate yourselves with as well. Dialing 988, so that's a new initiative, if you've heard of, that they started this year. It's the National Suicide Prevention Hotline, so it's 24/7, completely free and confidential. So that's an important one if you notice that you're struggling with suicidal thoughts or a loved one is struggling with suicidal thoughts. That can be a helpful resource as well. And then if you're in crisis, so if you're noticing some of these symptoms are really severe, you feel like you cannot manage, you can go to your medical emergency, your local medical emergency or behavioral health center, where they can provide treatment or assistance from there. And then, of course, if you have any questions, you're welcome to, please feel free to reach out to me, and I can provide more resources or answer any questions that you might have. Thank you.
Okay, thank you. So, Anila, you had mentioned kind of trying some of these mental kind of health exercises on our own at home, things we can do at work, you know, as we're going about our daily lives. Do you have any that you found are particularly helpful for depression versus anxiety, or do you recommend certain specific ones to your patients?
Yeah, I think ones that we commonly recommend for depression is those gratitude exercises and journaling. So journaling is a helpful way to kind of process our emotions, process our experiences. Kind of getting those thoughts out on paper can be helpful. And gratitude exercises in the morning, kind of recognizing things to be grateful for, right? Sometimes when we're struggling with depression or some of those emotions, it's hard for us to recognize those things. So those can be helpful practices. I think with anxiety, a big one that we recommend is those deep breathing exercises. Because like I said, with anxiety, we might notice some of those strong physical symptoms. So practicing deep breathing can help, you know, ground you, increase the oxygen to your brain, and kind of regulate your breathing.
Thank you, Anila. I get depressed very often, but unfortunately, I'm easily distracted. So I cannot stay depressed for long. So a good thing. I have two questions for you. One is, you mentioned many symptoms, but would you point out one trigger point? Hey, you see this one, get help. Is there a trigger point you would find out? That is one thing I want to ask. The other thing is, again, you mentioned many things which will relieve or give comfort for depressed. If I can give you reveal one secret of Lalita, when she is depressed, she wants to listen to music and she feels much better. Mm-hmm. So is there that kind of experience personal, or you have to find out what keeps you going? Is it something like that? So two questions. Thank you.
Yeah. So the first one, I think a big one that I tell people to kind of look out for is if you recognize that your symptoms are interfering with your day-to-day life, right? So if your anxiety is causing you to avoid situations or avoid places because you can't handle those symptoms, that is when it could be problematic. Or with your depression, if you have no motivation to do daily tasks, that can be when it can be problematic and you might want to reach out for help. With your second question, yeah, I think it is very personal. Everyone, like I was saying, everyone experiences their emotions a little bit differently. So different things can work for different people. So it's kind of important to recognize what works for you. So what is something that you find therapeutic? What is something that normally brings you joy? Maybe it's listening to music, going outdoors for a walk, right? Finding those things that are helpful for you, but also being open-minded to trying different things, right? Sometimes we hear these tips and we're like, oh, that might not be helpful for me, right? Like, oh, deep breathing isn't gonna work for me, or, oh, meditation isn't something I can do. But it's important to be open-minded and try some of these things, and we might be surprised at what might work for us.
First of all, I just want to thank you for talking about this issue that I feel like definitely doesn't receive enough attention as it should for the high health disadvantages and risks that it has. And I also agree with you on the point that it's something that in our culture that we might not really give as much heed to as, say, like a physical ailment. So what is something that we can do as both a Malayali and a Christian community to help those who suffer with mental health disorders?
I think a big one, and probably the easiest one to start with, is, like I said, just talking about it more, right? Normalizing those conversations. Like you said, you're right, we don't talk about it enough. So I think people that might be struggling with these symptoms, they don't feel comfortable communicating that they're going through these things. Or the families of people that are experiencing these symptoms, they might feel isolated. So having these conversations, talking about these things, recognizing that these are things that a lot of people are experiencing, and making people, not feel alone. I think as a community, that's the first initiative that we should take, is just normalizing those conversations. And I think just supporting one another through those things, We talk about God's love, and I think, like I said, I think it's beautiful that we have this community that a lot of people aren't fortunate to have. So I think we should really utilize it to support one another and uplift one another through some of these things that people might be experiencing.
Hi Anila, thanks for the class. So far I didn't know that I have any depression or something, but all the symptoms you have shown, it feels like I'm having something, or like I cannot eat more, I am having a less sleeper person, and I'm not doing any exercise or something like that. Anyway, it's fine. My simple question, like one of your courses you are showing that hereditary, inheritance, if any proven record, or it is just one of the trail you are talking about. Hereditary, it can happen or not?
Yeah, it is actually proven, and I can give you some resources on kind of the science behind it, but similar to what I was talking about, how it can be like a chemical imbalance in the brain, some of that can be genetic. So if someone has family members that experience some of these disorders, might have gone undiagnosed, but those people are more likely to have, or are more at risk to have some of those things as well. Yeah.
Anila, are there any signs and symptoms of anxiety that in particular, should cause you to seek the ER? Or the emergency room, looking for another kind of other cause, physically?
Yeah, I think it's if you feel that like the anxiety is unmanageable, if you're not able to get some of those symptoms under control, especially with anxiety, like some of those physical symptoms, if anyone's experienced like a panic attack, right? If you're not able to get those symptoms under control, if you feel like you're physically at danger or your health is at danger, I think that's when it's important to seek help. Yeah.
Any other questions for Anila? Okay. If there are no other questions, I just want to thank Anila again for being the first of the speakers in this series. We're really thankful that she took up the job today to do this and to share her wisdom with us. Just from the medical perspective, we've known that stress is a giant risk factor for a lot of other chronic medical illnesses that do get more press, things like myocardial infarctions, heart attacks, things like diabetes. We know that chronic stress increases our cortisol levels, increases our risk for diabetes, which then results in kidney disease, heart attacks, things like that. So chronic stress is a huge risk factor that's, kind of one of those soft things that's not quantifiable by numbers, but it does play a huge role in our health. So I think, even for those of us that don't feel that we have anxiety yet or depression at this point, a lot of the things that Anila mentioned are things we can use preventatively, even at this point. So just like we do preventative care for all our other medical, health, we can do the same thing for our emotional and physical health now. And we can start at any time. So thanks again, Anila, for everything. I'm just going to ask Xenia to wrap us up with prayer.
Let's bow our heads in prayer. Abba, Father, we thank you for this beautiful morning, that you've brought us here, Lord. Lord, we thank you for all that you've given us, all the blessings that you've showered upon us, our families, our friends, our homes, a warm place to stay, a warm car to get here in the morning, a house with food. Lord, we're so thankful for all you've provided, Lord. Lord, I pray that each and every day that we are able to wake up and thank you for all the things you've given us, all the things you've provided for us. Lord, I pray that we are able to recognize any mental health issues that we may have, our families may have. Lord, I pray that we open our minds to be compassionate to those around us, to be Christians, to show how much you are a friend who's there in need when no one else can be, Lord. Lord, I pray that we can continually depend on you, but also be the ambassadors for you, showing that love and compassion, especially those with mental issues, even when we don't understand it, even when we haven't gone through it, Lord. Lord, we pray for today, for the rest of the service, this upcoming week, Lord, that we may be able to praise you and to continue to go to you for guidance in all things, Lord. Lord, I pray for each and every member of our church, especially those that struggle with mental health, Lord, that this is a time to open the discussion within our church, within our community. Lord, we ask everything in your precious name. Amen.
താങ്ക് യു വെരി മച്ച്. പ്രത്യേകിച്ച് ഇന്നത്തെ ക്ലാസ്സിൽ സംബന്ധിച്ച നിങ്ങളെല്ലാവരോടുമുള്ള നന്ദി, സന്തോഷം അറിയിക്കുന്നു. അനില വർഗീസിനെ അഭിനന്ദിക്കുന്നു. അതിന് തയ്യാറായതിൽ ദൈവത്തിന് സ്തോത്രം ചെയ്യുന്നു. മോഡറേറ്റ് ചെയ്ത സിനിയ ജോർജിനെയും ദൈവം അനുഗ്രഹിക്കട്ടെ, നന്ദി പറയുന്നു. തുടർന്ന് ഉള്ള ക്ലാസ്സുകൾ മുൻപോട്ട് പോകുമ്പോൾ എന്തെങ്കിലും ടോപ്പിക് നിങ്ങളുടെ ഡിസ്കസ് ചെയ്യണമെന്ന് ആഗ്രഹമുള്ളതുണ്ടെങ്കിൽ അത് അറിയിക്കുന്നത് നല്ലതായിരിക്കും. നമ്മുടെ യൂത്ത് ഗ്രൂപ്പ് യുവജന സഖ്യം അവരാണ് ഇത് ഓർഗനൈസ് ചെയ്യുന്നത്. അങ്ങനെ അറിയിച്ചാൽ അതിനനുസരിച്ച് നമുക്ക് ചെയ്യാം. ഒരു പ്രത്യേക ക്ലാസ്സായിട്ട് വേറൊരു ദിവസം അങ്ങനെ വേണമെന്ന് ആഗ്രഹമുണ്ടെങ്കിൽ അതിനും നമുക്ക് സൗകര്യമുണ്ട്. നമ്മൾ ഈ ക്ലാസ് സെഷൻ ഇപ്പോൾ നമ്മൾ റെക്കോർഡ് ചെയ്തിട്ടുണ്ട്. അത് നമുക്ക് നമ്മുടെ യൂട്യൂബ് ചാനലിൽ അവൈലബിൾ ആകുവാനായിട്ട് ശ്രമിക്കുന്നുണ്ട്. അതും ഷെയർ ചെയ്യുകയും കാണുകയും ചെയ്യാം. ഇതിനു പിന്നിൽ പ്രവർത്തിച്ച എല്ലാവരോടും, പ്രത്യേകിച്ച് ഇടവകയുടെ സെക്രട്ടറി ശ്രീ തോമസ് ലാത്രയോടുമുള്ള നന്ദിയും സന്തോഷവും അറിയിക്കുന്നു. ദൈവം നമ്മെ അനുഗ്രഹിക്കട്ടെ. ഒരു കാര്യം കൂടെ പറയട്ടെ. നമ്മൾ ചിലപ്പോൾ പുറത്തോട്ട് ഇനിയും പോകും, എന്നിട്ട് തിരിച്ചു കയറി ആരാധനയ്ക്ക് വരും. ഇപ്പോൾ ഒരു കുർബാനയുടെ പ്രിപ്പറേഷൻ ടൈമാണ്. ഈ സാങ്ച്വറിക്കുള്ളിൽ ഒരു ശബ്ദമില്ലാതെ നിശബ്ദമായി ഇരിക്കാനായിട്ട് നിങ്ങൾ പ്രത്യേകം ശ്രദ്ധിക്കണം. അകത്ത് പ്രിപ്പറേഷൻ്റെ ഒരു ടൈമും അതിൻ്റെ പ്രേയേഴ്സും ഒക്കെ നടക്കുന്ന സമയമാണ്. അപ്പോൾ അതുകൊണ്ട് ദയവായി നിങ്ങൾ ശ്രദ്ധിക്കണം. നിങ്ങൾക്ക് സംസാരിക്കണമെങ്കിൽ താഴെയോ അല്ലെങ്കിൽ ഫോയറിലോ ഒക്കെ പോയി സംസാരിക്കാൻ, എന്തെങ്കിലും അത്യാവശ്യം പറയണമെങ്കിൽ. അല്ലാതെ പ്ലീസ് keep silence inside the sanctuary, because everyone have to be or should be in a meditative mode before the worship service. Thank you very much.